In this episode, we will explore how socioeconomic status, health economics, and the cost of healthcare impact health outcomes for Black communities, specifically in the context of HIV and COVID. Poverty is a key factor in health disparities, with Black people more likely to live in poverty than any other racial group in the United States. This impacts access to quality healthcare, nutrition, and safe living conditions.
Healthcare, like housing, should be a human right. And for arguably the world's largest and wealthiest country in the world to have the worst health outcomes of its citizens is a slap in the face of everything that I think people try to promote as good and well and fine. In addition to that, I think that there's a legacy of chronic health conditions that exist in our communities that really touch on medical racism, the mistreatment of Black folks as they engage in care, the poor quality of care that they may receive, which still explains why Black mothers experience mortality rates that they do and Black babies as well.
The quality would say everybody could go to the Fulton Board of Health site. Everybody could register, but equity says everybody is aware of what they have access to. And we are eliminating the barriers for all people to get it. It's only after it was called out that folks then realized we got some amazing organizations in Atlanta, such as Thrive SS. Maybe those should be the key stakeholders. Different health issue, same disparities, same challenges, because of the people who are the decision makers over our health care.
The burden of HIV and COVID-19 has fallen heavily on Black communities, and the economic impact of these disparities has been devastating. People living with HIV and COVID-19 are more likely to face financial challenges due to medical costs, lost wages, and reduced productivity. For those living in poverty, the economic strain can be overwhelming.
People are often born into poverty, and it's been poverty that their mother, their grandmother, etc. has experienced.
For a family of four, it's defined as making less than $26,000 a year. More than 38 million Americans live in poverty. For Black Americans, it's 1 in every 5, higher than Latinos, Asian Americans, and more than double the rate of white Americans.
There are myriad types of equity that are missing for marginalized, highly marginalized people, Black people, brown people, trans people, people of gender non-conforming status, and it's a problem. It's complicating our lives. When I would talk to young Black gay men who took their meds on a daily basis, who had achieved viral suppression, they still felt like vectors of disease transmission and felt like they did something that disenfranchised them from their inalienable right to pleasure and love. And I think that these things were building the case for the lack of health equity in my community, but I didn't have the awareness. HIV is a symptom of the lack of health equity, right? You know, and systemic racism and a whole bunch of things. Don't you leave here thinking that is only one thing, right? It's just like this confluence of like a whole bunch of things, right? But, you know, how do we, as opposed to putting out these disparate fires, how do we attack the whole fire?
The cost of healthcare is a major barrier for Black people. With insurance coverage often limited or inadequate, the high cost of prescription drugs, medical procedures, and hospital stays can result in untreated illnesses and delayed care, ultimately leading to worse health outcomes.
When we look at public health infrastructure, there is overrepresentation of Black people in low-level positions, outreach workers, peer navigators, linkage to care coordinators, but there's an underrepresentation of us as commissioners of health, HIV directors. And so if we're not in the position of decision maker, doesn't matter how many Black people are in the institution, we still don't yield the health outcomes desired by Black communities. There isn't a course that you can take in any college or university that focuses on things such as code switching, right? That focuses on things such as understanding how I gotta show up in settings to get what I need for my community, and knowing that the people seated around the table, they're looking at the bottom line. They don't really care whether we live or die. They do care how they're presented in the media, and they do care that they are known as a center of excellence. So many people in our community are accessing public health institutions because of a lack of health insurance. So this is the place where I can go. And when I get there, it reminds me this is my last resort. From the way that we are treated from the front door until we exit. And that's a model that has to change.
There's still issues connected to environmental racism, including redlining, including zoning, including real estate, including home ownership. You know, many people recognize the power of property taxes and supporting school education. So if you consistently rob people of their ability to do for themselves, and at the same time insist that they pull themselves up by their bootstraps, to me is sort of what are we ultimately talking about here? Why
am I in this situation? Just because of the color of my skin, just because I'm Black, just because my mama didn't go to college, or any plethora of reasons. Now I have the tools, I feel, to elocute on their behalf, to execute on their behalf. Health equity is important because it dictates how we show up, or if we show up for ourselves. I was raised thinking Black boys go to jail, Black people get diabetes, people who use drugs get Hep C and HIV, people who are gay get HIV, Black poets who are like me die young from HIV. That is not a thing that we should have to acquiesce to. I know that the benefits of health equity land people in places where they feel like they can do anything. I've observed, people in stage 4 cancer on Oprah, talking about their end-of-life planning and, how they microdose psilocybin to feel better and to deal with their depression and anxiety. But what I didn't hear about was adverse childhood experiences, that complicate the lives of people like me, that leave people like me susceptible to getting HIV, cancer, depression, suicidal ideology. And that's why I say often when I'm talking about this work that is stressful AF sometimes, that I get to do this work that is a pleasure to get to be stressed out, because now I have a lens that I didn't have, that is so important, because every poor Black person is not going to go to college. Every poor Black person who is highly oppressed and marginalized is not going to start a nonprofit, and nor should they have to be privy to these conversations. So it gives me what I need, the armor that I need to fight on the behalf of my community.
By recognizing the impact of poverty and socioeconomic status on health outcomes, we as a whole can work towards a more equitable future for Black communities.